diabetes is an epidemic in our community now. 10% of Californians roughly have diabetes, 45% have pre-diabetes. We need to, if not for the human aspect of this, get ahead of the economic cost curve so that we can figure out how to do what's humane and actually prevent disease. So I was excited this year when there was an evidence-based proposal supported by the Center for Disease Control, which showed how to both save money and prevent disease. So when the diabetes prevention program was presented to us, I was excited to figure out how to get funding for that program. And now our Medi-Cal patients will have an opportunity to be scared straight. Because when they came to me in the ER, I loved seeing them, but I was so busy running to the next patient, I never had enough time to educate them and tell them about the disease that they were facing. That the first time they got the news that they had a high blood sugar, that I wasn't spending the time to tell them about how they needed to change their behaviors, to eat differently, to face the fact that this was a chronic problem, that if they did not get ahead of, would drastically affect their lives. So the diabetes prevention program gets them to meet somebody who's lost their eyesight, who's on dialysis, who's lost a limb, all within the first 30 days, to hear from their mouths that if they lost 15 pounds, if they started to walk and go to the park more, that we may have an opportunity to get ahead of a problem. And so I was pleased to come here today to hopefully hear some more of these ideas. What can we as a state be looking at with a vision for the future? Because so many within our communities need to be able to access these healthcare services, and we as a state need and have a responsibility to be expanding our services to better serve our communities.